Morgan Norris, and I'll be performing a new bed linen change. The first thing that you're going to do whenever you get into the client's room is you're going to introduce yourself. Hi, my name is Morgan Norris. I will be your nurse today, and today we're going to change your bed linens. The next thing you do is you ask them to look at their wristband and make sure, ask them for their first name and their last name and their date of birth, and make sure it corresponds with your charts and what they're saying for their wristband. The next thing you're going to do is perform hand hygiene. You can either use the soap in the water, and this one has the leg thing, or you can just use antiseptic soap, the gel, and just make sure that you rub it in all the way and that it's dry before you start doing anything. The next thing is you're going to tell them we are going to be doing a bed changing linen today, and we are wanting to make sure that we let the bed rail down, and we're going to get her to turn on one side. And we can keep the pillow on her so she has enough cushion. She's not laying down too much, hurting her head, hurting her neck. You're going to keep her covered with the middle sheet, but we can pull the blue sheet off and out of the way because we won't be changing that. The next thing you're going to do, you're going to make sure you have all your supplies, a new fitted sheet, a new middle sheet, and a pillowcase. The next thing, you're going to grab the old one and you're going to roll it to her. Make sure you roll it in there as much as you possibly can, but also making sure that you keep her covered up, because patient privacy is one of the biggest things that hospitals do. Okay. We're going to get a new fitted sheet, and make sure not to shake it or to put it in the air too much, because we don't want it to be contaminated before the patient even uses it. And we're going to roll it up again next to the old ones. And try to get as much in there as possible. Okay, next we're going to lift the bed rail back up. And we're going to roll it to this side, but still continuing to keep her covered. Some patients will actually be able to hold themselves up, but some might not be able to, so you'll need a new partner. And you can tell them to hold the rail if they can, but if they cannot, then you will have to have another partner to hold the person. Next, you're going to unroll out the old, and make sure not to touch it because you don't want to contaminate your uniform, so whenever you get done with this patient you won't contaminate another patient. You don't put the sheets on the floor, you don't hold them close to your body, you always have them angled out and have a bag ready to put them in. The next thing is we're going to get the new sheet. We're going to make sure it's tight, because if the bed starts to get wrinkled, that will promote skin breakdown, bed sores, ulcers, skin ulcers, and you don't want that in a patient. You don't want to cause new problems. So you want to make sure it's as tight as it possibly can be. Okay, and we're going to turn her back on this side. We're going to make sure she's still covered up. Good. We're going to get the new sheet. And we're going to put it on her. And this is also, you don't want to shake or flop around in the air because you don't want it to get contaminated either. What you'll ask your patient to do is to hold on to the new sheet while you pull out the old sheet, but Holly's gonna help me out since our mannequin cannot, and she's gonna hold the new sheet while I pull the old one out. Still making sure to keep the client covered to where there's always privacy. And again, do not put it close to your uniform. Make sure that you have it and you can put it in the back. Next, what you're gonna do is get the sheets. You don't want any of the sheets to hit the ground because you don't want them to be contaminated by that. And make sure she has enough blanket up here to keep it comfortable. And what you're going to do is you're going to put these together and you'll pull them as tight as you can underneath the bed so we can do our corners. Okay. And then do this side. Make sure to get it as tight as it can be. You'll do your corners. The last thing that you'll do is change out the pillow. Because you always want to make sure that the patient has, her head is supported, she won't get any neck pains or head pains. You want to do it as fast as you can so she doesn't get a headache or anything. Again, don't touch the pillowcase with your uniform. And you will not put the pillow underneath your neck to put it in. You'll thread it in. Put it back up. Make sure it's a good position for her. We'll pull her blankets back. Make sure her arms are out. She's not stuck in the sheets or anything like that. Again, on this side. Make sure her arms are out. You can raise her head up. And then you'll make sure your bed rails are all the way up on each side, and you'll make sure her coverlet is in reach if anything has to happen. And you will perform hand hygiene again, and you will exit the room.